bless you all. They say on the stage you should never share it with children or animals. I have to tell you, there was a doctor sharing the stage with patients telling their stories is equally hazardous. Meredith and I know this is our third day in the organisation, working with you to explore some aspects of compassionate caring. One of the things we want to say is that we're in no way here to come to teach you how to do compassionate caring, because this is something that's deeply embedded within the organisation. But this is the nature of the healthcare system that we're in. Like Dave talked about, that in 15 shifts he only met the same nurse 3 times. That when you're seriously ill, critically ill, you can feel so frightened and bewildered, and your care is so complex and involves so many hundreds of different staff. How do we work together to ensure that all the needs of patients are met? And so what we've been doing is running some workshops with staff and asking staff to tell stories of extraordinary connection with patients, and those times when there was such a heartfelt connection and compassionate caring. And to teach a process that you can use with your own staff and students to draw out these stories and to learn and to uncover the knowledge that's already in the organisation about how you can respond to some of the needs that Dave and Renee have mentioned. My wife Meredith's here, and we have been through some experiences ourselves. Our 18-year-old daughter crashed a car and had an unstable C-spine fracture and was in spinal traction for 3 months on an orthopedic ward. And subsequently has been in hospital for other reasons with another life-threatening illness. And so when you write so eloquently and beautifully, and you're a powerful writer, of your experience of arriving on a ward in a strange place, feeling so lost and so frightened and so bewildered and all alone, and the family not there and your loved ones not there, and the one link you have to some safety, which is a call bell, somehow Canterbury is out of reach. That is a feeling of profound vulnerability. And I want you to listen to what she said, the little hint she said about what is profoundly important about that. It's about the human touch. It's about paying attention to all the little details of care and making sure that the call bell was in reach, that there actually is a wheelchair that you can use. That people introduce themselves. And what we've heard in the workshops we've been doing with the staff here, and many of you in the room have been at some of those, is just wonderful stories of making that human connection, of touching patients in a way that's not just about percussing the chest or measuring a blood pressure or feeling a pulse, but non-clinical touch. The comfort and caring that can be shown with holding the hand, a touch on the arm, a rub of the back, just sitting down someone, perhaps in silence, just being present for someone. And from my experience, and I'm sure from yours, that these are the things that make you feel valued, comforted, feel safer. There's other stories we heard about your staff choosing very deliberate practices of small acts of kindness. Dave talked about being taken down to X-ray of someone being lost for 2 hours. So when you're walking the hospital corridors and you see someone looking a bit lost, to stop, to say hello, to ask, can I help? And then someone says, I'm trying to get to this department or this ward. Not to give them directions, but to take them by the arm and take them for a walk and find the place they need to be and ask them their name, a little bit about them. And there's all those little bits of human touch and caring that make just a tremendous difference. Renee, she describes so vividly some of the things that happen that really make patients feel invisible. The handover outside the door when I don't know how many doctors and nurses are talking about Renee as if she's not actually there at all. And this sometimes occurs on the wardrobe, talking across the bed as if the patient there is the patient thinking, hang on a sec, am I supposed to be part of this? Are they actually talking about me? Is this my body? Am I supposed to make a comment? Am I supposed to be part of this? And so it's having that sensitivity that all of the time it's so easy to objectify patients and talk about the gallbladder on ward 6. Actually, there's a human being connected to that. And at all times, just to try and be sensitive to the fact that there is a very vulnerable, frightened human being here that is deserving of our care and attention, and involving the loved ones and the family in that at all times. And we can recall many experiences when our daughter Chloe was just so distressed and so afraid, and we were kind of locked out of the room because it was outside of visiting us. And how we had another story this week of someone who was a staff member, had a mother in the hospital, but she had a swipe card, so she could get in and kind of break the rules and be there, you know, in the middle of the night or whatever. So this, I hope, we are just profoundly impressed. This is our third day here in the organisation. We're profoundly impressed with this new strategy that's been launched. This is the first health board in the country that we are seeing, you know, just giving such a high priority to centering care on the needs of patients and families and bringing deep love and compassion in support of that care. And the workshops we've been running have been attended by, you know, huge numbers of senior people, which is demonstrating to us the organisational leadership commitment to say this is a most important strategy. And from all the research that we've done and all the experience, we know that loving, compassionate care elicits in the patient healing responses that make a dramatic difference to clinical outcomes, make a dramatic difference to survival, make a dramatic difference to your immune system, make a dramatic difference to your chance of getting out of hospital. And it's an effect size that's many times more powerful than most of the medicines that we have. And it's just of crucial importance. So many warm congratulations to this organisation. Thank you so much. I can see many faces in the audience that have told us the most profound stories of their commitment and their passion and their love and their generosity and their courage in going the extra mile, breaking all the rules and doing what's right for a patient and family. So thank you so much. And Renee, we're blessed to hear your story. I hope that can be shared widely. You are a wonderful writer, and it's just such a vivid, moving account of what it's like to be a patient.